One of the most common questions I get is, how can I have a healthy pregnancy? This is a great question because planning in advance allows best outcomes for mothers and babies. Hi, I'm Dr. Jeffrey Ecker, a high-risk obstetrician and chief of Obstetrics and Gynecology at Mass General Hospital and a professor at Harvard Medical School. And this is Staying Healthy with Mass General Brigham, preparing for a healthy pregnancy. Establishing healthy habits and a healthy lifestyle can help assure best obstetric and reproductive outcomes. Let's start by talking about weight, exercise, and diet, things all of us can probably always benefit from. Being at an ideal weight starting a pregnancy can help reduce the risk of early pregnancy loss, miscarriage, can help prevent certain birth defects, reduces the risk of developing later complications, such as high blood sugar, known as gestational diabetes, or high blood pressure, and may even reduce the risk of stillbirth. Exercise is an important part of managing and maintaining weight. Most programs of exercise begun in advance of pregnancy can be safely continued during pregnancy, the exception being those activities that risk falling and/or hitting the abdomen, because that's where the growing uterus will soon be. In thinking about diet in advance of pregnancy, there really is nothing to avoid, as long as eating happens in appropriate amounts. Because of some data, some recommend reducing coffee or other caffeinated beverages to just 1 to 2 cups a day. And since kicking the caffeine habit can be difficult to do quickly, adapting in advance of pregnancy may be something you want to consider. Vitamins and having recommended daily allowances of things like vitamin A, D, B vitamins, and if you are anemic, iron can be an important part of diet. You can get recommended daily allowances either in your food or through vitamin supplementation. In thinking about most important vitamins to target in advance of pregnancy, folic acid, also known as vitamin B9, is the most important. Appropriate amounts of folic acid, obtained often through supplementation, have been shown to reduce risks of important birth defects like spina bifida. You can obtain adequate amounts of folic acid simply by taking folic acid alone at doses of 400 micrograms or higher. Alternately, to assure adequate amounts of folic acid as well as all vitamins, some prefer to start a prenatal vitamin that can be obtained over the counter. Separate from diet, it's important to think about other exposures that may bring risk to pregnancy. That includes some things that are legal, like tobacco, alcohol, and marijuana. Just because things are legal doesn't mean that they're safe and best to take in pregnancy. Counseling and using things like nicotine gum or other substitutions can help here. Considering other exposures, including use and misuse of substances like opioids and amphetamines, is important here. Seeking help in advance, including counseling and treatment, allows these conditions to be managed as a chronic illness during pregnancy and points to best outcomes. Vaccinations are another important element of a healthy lifestyle. Certain viral infections can affect pregnant patients more severely and in some cases cause birth defects. As a result, it's very important in advance of pregnancy that you're up to date on all your vaccinations. That's especially so because some vaccines are live viruses and can't be taken in pregnancy. An example of a vaccine you should be especially certain to have in advance is MMR, because that's a live viral vaccine and can't be administered during pregnancy. Being vaccinated with MMR in advance also helps prevent important birth defects. 2 other important vaccines are annual flu vaccination and COVID-19 vaccination. These 2 vaccinations are particularly important because pregnant patients who are infected with flu or COVID are at higher risk for complications, including death. These vaccines also establish protection for the baby through antibodies shared through cord blood and breast milk. There is good evidence for safety and no evidence of adverse effects for each vaccine, no evidence that either affects fertility, fetuses, or newborns, and in fact, quite the opposite is true. These vaccinations are strongly recommended by obstetricians, pediatricians, the Center for Disease Control, World Health Organization, and all professional societies. Managing chronic conditions in advance of pregnancy is a double win. It assures a healthy birthing person and a healthy newborn. When preparing for pregnancy, it's essential to manage chronic conditions like hypertension, diabetes, asthma, depression, or anxiety. Because the early weeks of pregnancy are a key time for fetal development, Getting healthy in advance of pregnancy is important for best pregnancy outcomes. For those that have diabetes, for example, having ideal blood sugars can help prevent miscarriage and birth defects. In rare cases, for individuals with severe conditions that affect the heart or lungs or kidneys, speaking with your provider or a high-risk obstetrician can help you understand the effect of a pregnancy on your own health and whether or not you are healthy enough to safely carry a pregnancy. Review all prescription and non-prescription medicines with your health provider and be sure they understand that you are planning a pregnancy. One vital thing to emphasize is never to stop taking medicines on your own. It is important to understand what risks you and your partner may have for carrying genetic conditions. That allows you to anticipate the chance of having a child with a particular condition. Two of the main ways to understand these risks are first to review your family history with your medical provider, and then to consider with them blood testing to identify your own carrier status. Some examples are cystic fibrosis, sickle cell anemia, Fragile X, and a long list of rare conditions most have never heard of until they talk with their pregnancy care provider. The good news is that most pregnancies are healthy. Optimizing care in advance can make that even more likely. Regardless, seeking care early when you find that you are pregnant is essential. Click here for more videos on women's health from Mass General Brigham.